So we typically, depending on the surface area required for the anesthetic administration, and especially in this case where we're dealing with the entire maxillary arch, we do want to anesthetize the entire maxilla basically from molar to molar. So we want a volume that would be sufficient for that region. As such, EXPAREL comes in the 13.3% concentration in a 10 cc vial. We will expand that to a 20 cc total volume with the same percentage concentration, and then inject according to the guidelines for the deposition of the EXPAREL. In the case, you'll see the full thickness skin flap, which has been elevated, and then the EXPAREL is injected using the 25 gauge needle, and in this case we use the 20 cc volume, and injecting 1 centimeter increments, or 1 centimeter spacing between each injection site. This is injected in the supraperiosteal areas, that is into the muscle layers. Really, the subperiosteum does not need to be injected. That's not the area that we want to anesthetize and make comfortable for the patient, but it is in the supraperiosteal or submuscular plane. So in the infraorbital areas, and then also around the zygomaticus major and minor muscles, as well as around the perinasal region, giving good local anesthetic administration in all those areas. Finally, I do like to inject a little bit in the posterior maxillary buttress region bilaterally, and that will give essentially good nerve blocking around the cheek areas. And you'll see with the 20 cc volume, you have a lot of volume to work with, which you can easily, get a good surface area covered. And there's the completion of the full 20 cc syringe.
Indication: EXPAREL, bupivacaine liposome injectable suspension, is indicated for single-dose infiltration in adults to produce post-surgical local analgesia, and as an interscalene brachial plexus nerve block to produce post-surgical regional analgesia. Safety and efficacy have not been established in other nerve blocks. Important safety information: EXPAREL is contraindicated in obstetrical paracervical block anesthesia. Adverse reactions reported with an incidence greater than or equal to 10% following EXPAREL administration via infiltration were nausea, constipation, and vomiting. Adverse reactions reported with an incidence greater than or equal to 10% following EXPAREL administration via interscalene brachial plexus nerve block were nausea, pyrexia, and constipation. If EXPAREL and other non-bupivacaine local anesthetics, including lidocaine, are administered at the same site, there may be an immediate release of bupivacaine from EXPAREL. Therefore, EXPAREL may be administered to the same site 20 minutes after injecting lidocaine. EXPAREL is not recommended to be used in the following patient population: patients under 18 years old and/or pregnant patients. Because amide-type local anesthetics, such as bupivacaine, are metabolized by the liver, EXPAREL should be used cautiously in patients with hepatic disease. Warnings and precautions specific to EXPAREL: avoid additional use of local anesthetics within 96 hours following administration of EXPAREL. EXPAREL is not recommended for the following types or routes of administration: epidural, intrathecal, regional nerve blocks other than interscalene brachial plexus nerve block, or intravascular or intra-articular use. The potential sensory and/or motor loss with EXPAREL is temporary and varies in degree and duration depending on the site of injection and dosage administered, and may last for up to 5 days as seen in clinical trials. Warnings and precautions for bupivacaine-containing products. Central nervous system, or CNS, reactions. There have been reports of adverse neurologic reactions with the use of local anesthetics. These include persistent anesthesia and paresthesia. CNS reactions are characterized by excitation and/or depression. Cardiovascular system reactions. Toxic blood concentrations depress cardiac conductivity and excitability, which may lead to dysrhythmias, sometimes leading to death. Allergic reactions. Allergic type reactions, for example anaphylaxis and angioedema, are rare and may occur as a result of hypersensitivity to the local anesthetic or to other formulation ingredients. Chondrolysis. There have been reports of chondrolysis, mostly on the shoulder joint, following intra-articular infusion of local anesthetics, which is an unapproved use.